Hello, my name is Anna Lefit-Golombeski, and today I will be talking to you about acute bacterial rhinosinusitis. Start by talking about the bacteria that causes acute bacterial rhinosinusitis, which is Streptococcus pneumoniae. Streptococcus pneumoniae is a gram-positive spherical bacterium that can be found in pairs, which are called diplococci. This bacteria is also non-spore-forming and is non-motile. Next, the preferred environment for this bacteria to grow in must include temperatures being between 35 and 37 degrees Celsius, with slower growth at lower or higher temperatures. Must include having a source of catalyst such as red blood. Growth can be further enhanced by increasing the carbon dioxide of the environment by 5% or putting it in anaerobic conditions. Next, let's talk about symptoms of acute bacterial rhinosinusitis, which include inflammation of sinuses and nearby lymph nodes, high fever, purulent nasal discharge, and facial pain. It is important to note the distinction between viral and bacterial causes, as well as the duration of symptoms, plays a crucial role in accurately diagnosing acute bacterial rhinosinusitis, as physicians only correctly diagnose patients with this condition in about 50% of cases. Talk about pathogenicity. Pathogenicity of Streptococcus pneumoniae is linked to its ability to colonize in the sinuses and nasal cavity. The individuals who are at high risk for contracting this infection are the elderly population, young children, and individuals who are immunocompromised. It is important to seek medical intervention if you are at high risk for this infection. Next is valence factors. The valence factors of acute bacterial rhinosinusitis include polysaccharide capsule, pseudomycin, and autolysin, as well as cell surface proteins. These factors contribute to the pathogenicity of this bacteria that causes acute bacterial rhinosinusitis. First, the polysaccharide capsule is a key valence determinant that protects the bacterium from phagocytosis, allowing it to invade the host's immune response. Studies on Streptococcus pyogenes have demonstrated that the hyaluronic acid HA capsule promotes bacterial burden in nasal turbinates and skin lesions by resisting the neutrophil-mediated killing, highlighting its role in acute infections. Similarly, in Streptococcus pneumoniae, the polysaccharide capsule plays a central role in protecting the bacterium against phagocytosis, contributing to its pathogenicity. Pseudomycin is a cytotoxin that causes damage to the host cells, contributing to its pathogenicity of bacteria, causing acute bacterial rhinosinusitis. Autolysin, an enzyme that breaks down cell walls, also plays a role in bacterial virulence. Additionally, cell surface proteins such as PSPA, PSPC, and LYTA aid in respiratory colonization, further enhancing the ability of this bacteria to establish infection. Understanding these valence factors is a crucial role for developing effective strategies to combat acute bacterial rhinosinusitis. Research into these factors can inform the development of vaccine and therapeutic interventions. aimed at disrupting the protective mechanisms of pathogenic bacteria that causes acute bacterial rhinosinusitis. Next is lab diagnosis. Definitive lab diagnosing of Streptococcus pneumoniae infection generally relies on isolating the organism from blood or either from sterile body sites. The two most common forms are urinary and rapid diagnostic test. Body fluid test is used to detect capsular polysaccharide antigen in body fluids, such as a urinary antigen test. Rapid diagnostic tests have been developed to diagnose Streptococcus pneumoniae in about 20 minutes, with fluid samples from middle ear, discharge from ear, nasal discharge, or coughed up sputum. Next is treatment. The treatment that is normally used are antibiotics. The first one I'll talk about is amoxicillin clavulanate potassium. The mechanism of action for amoxicillin clavulanate potassium augmented involves inhibiting bacterial cell walls synthesis, thereby stopping the growth of bacteria. Trimethoprim is an antibiotic that works by inhibiting the synthesis of dihydrofolic acid in bacteria, which is essential for the production of DNA, RNA, and proteins. This inhibition ultimately leads to the disruption of bacterial growth and reproduction. Both amoxicillin clavulanate potassium augmented and trimethoprim are recommended for patients. Normally, the trimethoprim is used for someone who is allergic to amoxicillin and other penicillins. The duration of antibiotic treatment for acute bacterial rhinosinusitis is about 5 to 7 days, provided that the patient is improving. Summary: Streptococcus pneumoniae causes acute bacterial rhinosinusitis, and understanding its characteristics, pathogenicity, and diagnostic methods is crucial for effectively managing and treatment of this infection. Here are my citations that I used for this presentation, and I hope you now understand what acute bacterial rhinosinusitis is. Thank you.